Hello, everyone. My name is Liesel, and my condition is spinal fusion procedure. So, a spinal fusion procedure is when two or more vertebrae are permanently connected and immobilized relative to each other, often using a combination of screws, rods, and or bone graft. So you can connect any two or more bones in the spine. This could be in your cervical, thoracic, or lumbar spine. Connecting them prevents movement between them, which indefinitely prevents pain. Your lumbar spine is the most common, with over 210,000 procedures performed annually in the US. So, populations affected, it's more common in older adults. The mean age is about 60, more common in women than men, and usually women over 75 years. It is also more common in white patients. The overall demand is rising due to the aging population, and a study done by Wu et al. 2024 found that out of 111,914 patients who underwent cervical spinal fusions between January 1st, 2004 and March 31st, 2021, 50.9% of the patients were female. The mean age was 57.7, 77.2% of patients were white, while 11.3 were black, 8.5 Hispanic, and 1.7 Asian. So, some typical signs and symptoms before having the surgery that might lead to someone having the surgery would be chronic back pain. So, this can be pain during common tasks and leisure activities, kind of that pain that never goes away. Nerve pain, this is the burning or tingling sensations in your nerves. Often, the spinal nerves could be pinched. Weakness, so this is the weakness is the impact of pain over time. Weakness can put pressure on your spinal cord or the spinal nerves that branch off of it, which can disrupt the signals traveling through them, which overall can cause a lot of issues and pain. And then spinal instability. So there can be injury to the ligament supporting the spine, which makes your vertebrae loose and movable. So, course progression, I just decided, since this is like a medical treatment and a surgery, I decided to just talk about what does the spinal fusion treat. So here are just some examples of the conditions that spinal fusion procedures treats. This would be the congenital spinal conditions, herniated discs and pinched nerves, spondylolisthesis and spondylosis, scoliosis, spinal stenosis, and foraminal stenosis, spine fractures and injuries, tumors in and around your spine, and then also some like blood clots. So some complications could happen during surgery, although it is, or post-surgery, although it is rare. These could be infection to the site or just infection in the spine, poor wound healing, bleeding, blood clots, pain in the bone graft site, and or a return of symptoms of what happened before the surgery. So, some precautions post spinal fusion procedure would be to wear a brace. A lot of times people have to wear a brace to make sure that their spine is being kept straight as possible. No BLT, which we kind of learned about in foundation. So, this is no bending, lifting over 10 pounds, or twisting. And then you may need to learn how to hold yourself and maintain posture because it'll be different than what you're used to, and it affects your ability to sit, stand, walk, and move around. So you can bend forward at the hips, but you have to keep your back straight so you don't want to slouch. Be sure to bend at your knees when you lift. Do not lift with your back. No heavy lifting for 6 to 8 weeks after surgery. And then overall, your doctor will decide when lifting precautions are no longer needed. And then here's a picture of how to sit up from when you had the procedure. So medical treatment. So the spinal fusion surgery itself is medical treatment for um a- any condition, but so I just put in the steps to the spinal fusion surgery and then the different like ways to do it. So preparation, step two, accessing the spine. So they could remove a disc or muscle retraction. Step three is the actual fusion. So using a bone graft and stabilization. Step five would be closure of your spine. And then step six, I don't know why it says step five again, would be, or step four, five, recovery. So this would be hospital stay, physical therapy, occupational therapy. And there are four common types for lumbar, which was the posterior lumbar interbody fusion, which is most commonly for degenerative disc disease and spinal instability, the transforaminal lumbar interbody fusion, which is spondylolisthesis and nerve compression, anterior lumbar interbody fusion, which is degenerative disc disease, herniated discs, and spinal deformities. And then lateral lumbar interbody fusion, which is spinal stenosis, multi-level lumbar degenerative conditions. So then these are also different ways to enter to the spinal cord that I got from the Mayo Clinic. So this would be like fusion from the back of the neck, as you can see, and then fusion from the front of the neck, and then fusion options for the lower back, which would be like your primarily your lumbar. Yeah. So rehabilitative treatment. So OTs can help with patients post spinal fusion procedure by helping with ADLs, such as dressing, bathing, and cooking, and using adaptive equipment to make sure that they are not breaking their precautions. Also, getting in and out of a car is a big thing that we can help with because people do often bend their back to get in and out of a car. So practicing this and figuring out ways to make it work. Overall, just sit, move, and stand. It might feel a little bit different. It's less mobilized. So practicing that sit to stand a lot, planning routines, maximizing safety around the house, which also goes along with home assessment, and then overall self-care strategies post-surgery. So this can be like relaxation techniques, targeted stretches, guided meditation, all of those. So some community resources that I found, I couldn't find anything specifically for this spinal people who had spinal fusion procedures, but I did find just overall spine help groups. So the first one is the Spinal Help Center, which is a resource for those struggling with a spine condition, and it varies. There were a ton of spine conditions on there, so spinal fusion procedure could be one of them, or people who had it, and then it offers educational resources, insights from experts, and patient support community. So people can talk about their experiences. And then the next one is the Spine Health Support Group, which is through Mayo Clinic. And this allows people to ask any questions that they may have and share their own stories to help other people. So you can just write things and you can read things, and it seems super helpful. So these are my discussion questions. I will let you read them and answer them in the comments. And these are my references. Thank you.